Hi, and welcome to Gulf Coast Wellness. I'm Dr. Peter Shark. I just want to talk to you a little bit today about what's different about working with our clinic versus a conventional doctor. First off is our goal. Our goal is always going to be to bring you back to total health and wellness. Now, I know a lot of MDs would love to be able to do that, but unfortunately, they don't usually have the tools in their toolbox or the time to spend with you in order to reach that goal. So, most of the time, their goal is just going to be to slow your degeneration. Anytime a doctor recommends a medication or a treatment for you, you should ask, what is the goal of this treatment? Is it going to cure my underlying problem? Most of the time, the answer is going to be no. The next thing is a thorough intake. We spend about 3 hours in intake with a chronic illness patient. That's a lot of time. The average visit with an MD is 8 minutes. If you see a specialist, you might be lucky enough to get 20 minutes out of them, but you definitely don't get 3 hours. There's only a few clinics in the country that spend that kind of time on intake, and we're one of them. And the reason is we really want to understand the underlying problems in your system so that we can get you back to total function, health, and wellness. The third thing is insurance. This is the bummer one. Insurance probably will not pay for your treatment in our clinic. Why is that? Insurance was never designed to keep you well. It really is just a financial tool to keep you from losing all of your money if you have a catastrophic illness or accident that lands you in a very expensive hospital stay. It is not in any way designed to help you manage your health. The upside of this is because you're not going through insurance, the insurance company also cannot dictate your treatment. That means that you are in the driver's seat for deciding what therapies are working for you and which aren't, instead of having to check with an insurance company what is approved and isn't. And you'd be amazed at how much control they have in treatment decisions when you work with an MD. Frequently, MDs recommend only what they know can be covered by your insurance and not necessarily what's best for your health. Fourth on here is we only work with no side effect therapies. That means if you have a side effect from something that we recommend or that we do, we discontinue or modify that approach so that you no longer experience that side effect. So, what we will not ever say to you is keep doing that even though it's making you sick. I can't tell you how many patients I get that are on long-term treatments for chronic illness. They come into our clinic and they've been on something for years that's causing horrible side effects. Their MD knows that they're having horrible side effects, and they've been told to just live with it because they need the medication. Now, that's a really terrible position to be in. To be sick, to feel that you need a medication to manage your health, and then to be sick in some other way from the medication. So, our goal is always to work with the body. And when you work with the body, there are no side effects. The only side effect that I can't do anything about is that the herbs taste terrible. I'm so sorry. There's just nothing I can do to make them both effective and tasty. So that is the one side effect I will definitely tell you to live with. If your herbs taste terrible, you're just going to have to deal with it, get through it, and get the outcome. The number one way that we're different from a conventional doctor is that you are a participant in your health. And this has an upside, and for some people, it can feel like a downside. The upside is you're going to be involved every step of the way. You're going to understand what's going on. You're going to know why you're doing things, and you're going to be able to see the results. The downside is you actually have to do something to get better. So we do some therapies in the office, acupuncture, or I might send you home with herbs or maybe even some supplement recommendations, but you have to take them. You have to show up, and also We frequently recommend lifestyle and dietary changes, and a lot of times those are really the big guns in the therapy. So if you don't do that part, you might not get any of the results. If you're the kind of person who wants to be involved and wants to get better and is willing to do whatever it takes to get your health back, then it's perfect for you. You're exactly the right kind of patient for our clinic because you're ready to go and you're going to do what you have to do to get better. If you are hoping for a single acupuncture treatment cure, or you are hoping that you'll only have to change one or two things in your diet, but you're having some kind of serious long term chronic illness, then you may be really disappointed in our recommendations because frequently we rely on you to make the changes. We have the knowledge, we have the expertise, we can understand what's going on with your body, we can help explain it to you. But when it comes down to it, the action has to be yours if you want to get better. So if you're hoping for a quick fix, you're better off with an MD and trying a medication approach rather than trying a holistic approach, which may require a little bit of hard work. So I hope that made some sense to you today. If everything I said sounded great, then you're probably a great candidate for our clinic. We'd love to see you and love to see if we can help you. All you have to do is reach out via our webpage and let us know that you're interested. Be well.